Welcome to the Living Healthy Podcast, where you can improve your quality of life by making solid and informed decisions. I'm your host, Eddie Randall. Thank you for joining me this evening for another episode of the Living Healthy Podcast. In tonight's episode, I'll be talking about allergies. This podcast episode is entitled Food Allergies, Environmental Allergies, and Autoimmune Diseases, What You Can Do, Part 1. Now, this is a two-part series, and I'll be discussing allergies in depth. Allergies are a problem that many people face. They can be an inconvenience, and they can also be profoundly detrimental, resulting in death. Although allergies can be overlooked as not being as serious as other chronic illnesses, they are a growing concern as millions of Americans suffer from allergies every year. According to the Asthma and Allergy Foundation of America, every year over 50 million Americans suffer from allergies. It can be costly as well. They go on to state that allergies cost Americans $25 billion a year to treat. Allergies occur when the immune system overreacts to allergens. Allergens are substances that cause an allergic reaction. They can be anything from dust, pollen, pet hair, insect bites, latex, mold, food, medications, and even soap. Allergies cause the immune system to create an antibody called immunoglobulin E, or IgE. Antibodies are proteins created by the immune system to combat allergens, the things that they deem that are a threat. To people who do not have allergies, this can be seen as a foreign concept. Unfortunately, allergies can hamper the lives of many people, causing them to always be wary of food, medications, and their environment. Food. There are many foods that cause allergic reactions, and people with food allergies need to be wary of the food contents based on the type of allergic reaction they have. Some can be more severe than others. For example, anaphylaxis is where the throat can swell and close. I will get into more details about this later in the podcast. People with food allergies who experience anaphylaxis have to be diligent when eating out at restaurants, company parties, as well as Thanksgiving and Christmas gatherings, as the food they eat, unless they made it themselves, may have a particular ingredient that can be potentially life-threatening. The most common foods that cause allergies are peanuts, other tree nuts, milk, soy, eggs, shellfish, and gluten. As a warning, many manufacturers will have labels that say manufactured in a facility that processes nuts, wheat, and soy, or something to that effect, advising you of potential allergens. Some of the least common foods that cause allergies are honey, beef, avocados, bananas, and dried fruit. Sulfites are a flavor enhancer and preservative and are used in many foods. According to Healthline.com, sulfites in dried fruit can cause allergies. They go on to state that in Europe, manufacturers are required to list sulfites on food packaging. However, I found that in the US, it's also required to list sulfites on food packaging. I just wanted to make note of that because usually things that are banned in Europe are okay in the United States. That being said, although the FDA requires the use of sulfites to be listed, the FDA has banned their use on vegetables. This happened due to pressure and complaints to Congress and the FDA. The FDA has deemed sulfites safe, but there were a number of deaths that sparked backlash against the FDA. Unfortunately, the most formidable event in making the FDA change their view on sulfites was the death of a 10-year-old girl named Madaya Mcpike from Oregon. This happened in the mid-1980s. Madaya was eating at a restaurant with her family. Her father, James Mcpike, testified before Congress stating that his daughter ate some guacamole. When they got home, his daughter, who has asthma, complained and had difficulty breathing. She was rushed to the ER but suffered a heart attack. The lack of oxygen resulted in brain damage, and she passed away 5 days later. Doctors stated that she suffered an allergic reaction from the sulfites that were used in the avocados to keep them fresh. This is a very tragic and sad story. The bright side is that the FDA banned the use of sulfites on vegetables because of her death. This just reiterates the fact that people with allergies, in particular food allergies, need to be cautious of what they eat. Allergies are a very serious and potentially life-threatening condition. I'll put a link to the Mcpike story in the description of the podcast in case anyone is interested and would like to read up further. Moving on to more common food allergies. Other common foods that cause allergies are wheat, soybeans, sesame seeds, carrots, celery, mustard, strawberries, and cherries. Pretty much any food can cause allergies. Genetics play a huge role, as well as the level of exposure, as those determinants can illustrate the response. Treatment for food allergies. The best way to combat a food allergy is to avoid eating that type of food once you discover that you're allergic to it. That being said, there are common medications for allergic reactions to foods. Antihistamines help to curb swelling, runny nose, as well as itchy and watery eyes. Corticosteroids reduce swelling and inflammation. Epinephrine relaxes the muscles in the airway, making it easier to breathe. Many are available in nasal spray, pill, liquid, eye drops, autoinjectors, and cream. In addition, immunotherapy shots may be given by an allergist. Environmental allergies. Environmental allergies are very common and involve pollen, dust, mold, ragweed, bug bites, and animal dander. Allergy season differs depending on the part of the U.S. that you live in. In February through April, pollen is most prevalent. From May to July, grass and weeds become the dominant allergens. Then, from August to November, ragweed becomes the most dominant. Environmental allergies can hamper lifestyle, as they can interfere and prevent people from normal activities, including having fun outdoors. However, there are medications and precautions that can be taken to prevent or mitigate allergic reactions. Environmental allergies are also known as seasonal allergies, and they are sometimes called hay fever. Seasonal allergies occur when you're exposed to an allergen and typically stop when the allergens are removed. Hay fever, which is allergic rhinitis, it's similar to a cold, but it's caused by allergens and symptoms can remain even after the allergen has been removed. According to theallergyinstitute.org, hay fever can last for months even when no longer exposed to the allergen. As an example, it's commonly confused with a cold, but a cold can last for a short time. A cold with a runny nose is medically termed coryza with rhinorrhea. Rhinitis is when the nose comes into contact with a seasonal allergen, becomes irritated, and mucus is produced in order to flush out the nose. The Asthma and Allergy Foundation of America lists some of the common types of rhinitis. They describe allergic rhinitis, which is caused by allergens. Seasonal allergic rhinitis, aka hay fever, happens when an allergen from trees, grass, or weeds causes an allergic reaction. Perennial allergic rhinitis is caused by dust, mold, and animal dander. In addition to a runny nose, environmental allergies can cause sneezing, stuffy nose, sinus pressure, coughing, and red, itchy, and watery eyes. How the body responds to allergens. When an allergic reaction occurs, the body is exposed to allergens, and as stated earlier, the immune system overreacts. It creates antibodies and histamines, and they cause the allergic symptoms like runny nose, watery eyes, coughing, itching, scratching, etc. Histamine also causes blood vessels to dilate, smooth muscle to contract, stomach acid to begin secreting, and the eyes and nose to itch and become watery. Basic immunology in relation to allergies. I'm going to briefly go into some basic immunology as to better understand how this reaction works. Allergies are classified as hypersensitivity diseases, and this reaction is caused by the response to mast cells. Mast cells come from bone marrow. They reside near the blood vessels. They have a receptor called an Fc receptor. They attract an antibody produced by plasma cells called immunoglobulin E, or IgE. IgE production is induced by the Th2 cells. These cells are a type of helper T cell that are tasked with targeting and destroying invading antigens. When IgE bonds to the Fc receptor, the Fc receptor releases their receptors and releases other chemicals, causing the sneezing, coughing, runny nose, watery eyes, and in some cases, difficulty breathing that we all know as allergic reactions. Types of allergic reactions. There are 4 types of allergic or hypersensitive reactions: types 1, 2, 3, and 4. Type 1 is classified as an anaphylactic or immediate hypersensitivity reaction. It is IgE dependent, and this immune response happens within a few seconds to a few minutes. This reaction causes increased vascular permeability, vasodilation, along with bronchial contraction and inflammation. As stated earlier, antigens that cause allergic reactions are commonly known as allergens. Cytokines are proteins that are produced in inflammatory reactions and by T lymphocytes during the immune responses. 2 types of cytokines exist: interleukin 4 and interleukin 13. They are created by Th2, and they stimulate B lymphocytes, which produce immunoglobulin E. Type 2 allergic reaction. These are cytotoxic or antibody-mediated responses, and they happen when the body attacks itself and antibodies are created against antigens that the body deems as foreign. This reaction is antibody-dependent and is commonly found in autoimmune diseases. B cells are white blood cells, normally known as lymphocytes. They develop in the bone marrow. They make up about 25% of all white blood cells, and these cells also produce antibodies that stimulate the immune system, prompting the destruction of antigens. B cells are activated when the body comes across anything it believes that is foreign. When the situation arises where the body attacks itself, B cells create autoantibodies, resulting in disease and tissue damage. Some of the B cells become memory cells and quickly activate and take care of an antigen when it comes across it again in the future. B cells can remember antigens for years, giving you immunity against pathogens. IgG antibodies bind to Fc receptors of white blood cells, activating leukocytes, culminating in inflammation. In some instances, hormone disorders can arise when antibodies act against hormones, inhibiting their receptor function. Type 3 reaction. Type 3 is an immunocomplex mediated sensitivity reaction, and it can take several hours to set in. This happens when antibodies that are specific for cells and tissue antigens form complexes and deposit into the tissue, causing injury by stimulating inflammation. When soluble antigens form complexes with the antibodies, they can travel and become trapped in various tissues throughout the body. These complexes can be smaller than large complexes. The large complexes are normally taken care of by white blood cells, specifically macrophages. Leukocytes are activated when the complexes are deposited and the cells produce lysosomal enzymes, which can cause tissue damage. Type 4 allergic reaction. These are cell-mediated diseases and are autoimmune and normally occur 2 days after the initial exposure to the antigen. It does not involve antibodies, only the T cell and antigen. It takes time for the T cell to get to where the antigen is, and this in turn causes a reaction also known as a delayed hypersensitivity reaction. T cell mediated diseases are caused by CD4 or lysis or breakdown of a CD8 and CTL cell. CD4 is a glycoprotein that is found on T cells and is a receptor for the antigen. When an antigen is presented, CD8 recognizes peptides and produces antibodies to kill the invading virus, bacteria, and/or allergen. CTL, or cytotoxic T lymphocyte, are the actual killer cells that carry out the destruction of the pathogen. T cells can secrete cytokines, which can stimulate local inflammation. The T cells in mediated diseases are memory cells that can last for years. In response, a person that has this type of hypersensitivity can have this type of disease for years. Examples of type 1 reactions. Type 1 reactions can be caused by insect bites or stings, drugs, foods, and latex. As an example, I will use a drug allergy. One of the common drugs that most people or some people have an allergic reaction to is penicillin. Penicillin is an antibiotic used to treat bacterial infections from ear infections to STDs. If a person is allergic to penicillin, they are more or less allergic to cephalosporins. They are both similar in structure and are classed as beta-lactam antibiotics. Penicillins include amoxicillin, oxacillin, and piperacillin. Cephalosporins include cefepime and cefirazime. Drug reactions, including penicillin, commonly involve fever, skin rash, itching, shortness of breath, swelling, runny nose, and itchy, watery eyes. More severe symptoms include anaphylaxis, which is the tightening and swelling of the throat which blocks the airway. Other symptoms can include a drop in blood pressure, seizures, nausea, vomiting, and lightheadedness. A less common and very severe condition that can arise is nephritis, or kidney inflammation. On the American Family Physician website, there's an article called Diagnosis and Management of Acute Interstitial Nephritis by Codner and Kodramoti. They list penicillins as one of the primary class of drugs that is responsible for nephritis. If anyone is bitten by an insect or stung by an insect, we normally have an immune response. However, in some cases, some people have a response that is excessive. Our immune systems respond to the proteins in the saliva of insects or the toxins in their stingers. The reaction can include redness, pain, swelling beyond the affected area, hives, itching, and in severe cases, anaphylaxis can occur. The level of hypersensitivity can be more severe depending on the insect. Bees, ants, and mosquitoes tend to elicit a moderate response, while bites from fire ants and spiders tend to have a more severe response. Foods can cause a response such as itching in the mouth, a rash on the tongue and roof of the mouth, hives, facial swelling, vomiting, nausea, shortness of breath, and coughing are also symptoms. Food allergies are more common in children, as in the majority of individuals with this condition, they tend to grow out of it. However, some adults do not grow out of this condition. The reaction to food allergies can vary based on these certain conditions. This is why it's vital to pay attention to what their children are eating, but more so once they know what their child is hypersensitive to. The Children's Hospital of Philadelphia state that reactions can vary due to the amount of food eaten, the food preparation, and the amount of food protein that was consumed. Another type 1 hypersensitivity reaction involves latex. Although latex allergies are not as common as other allergies, prolonged exposure increases the chances of developing an allergic reaction. I never thought about developing an allergic reaction in all my years working in healthcare. I had no idea about the prolonged exposure. Latex originally came from rubber trees, and then man-made latex became available in the market. Hypersensitivity to latex involves 3 different reaction types. The Asthma and Allergy Foundation of America state that pure latex comes from the Brazilian rubber tree named Hevea brasiliensis. The site goes on to state that latex involves type 1 IgE reactions, type 4 cell-mediated dermatitis, and irritant dermatitis. Common latex products include gloves, blood pressure cuffs, elastic, balloons, condoms, and the tubing used in stethoscopes. Type 1 reaction symptoms include nausea, conjunctivitis, vomiting, and in worst case scenarios, anaphylactic shock. Even though I'm discussing examples of type 1 reactions, I'm mentioning this type 4 reaction to keep the arrangement of information consistent. Type 4 reaction symptoms include a rash and blistering. Irritant dermatitis, which can be common to healthcare workers, happens when the natural oils are stripped away from the skin, causing damage to the skin and allowing the irritant to enter the skin. Now, irritant dermatitis is actually a reaction to an irritant and not an allergic reaction. In so many words, it's opportunistic and can happen when the hands are dry and cracked or due to excessive or repeated hand washing. Buchart, Schomer, and Zerwis wrote an article called Differentiation of Latex Allergy from Irritant Contact Dermatitis. They state that irritant dermatitis is not an immune response, rather it occurs due to exposure to chemical as well as hand friction, resulting in dehydration of the skin on the hands. That being said, I don't want to make it seem like if you regularly wash your hands that this will happen to you. It's important to wash your hands regularly, which is several times a day before handling food, contact lenses, caring for your child, etc. The condition happens more or less with people who suffer from compulsive disorders who may overdo it. Washing your hands is extremely important for everyone, especially during the coronavirus pandemic. I wanted to take a moment to say thank you for supporting the podcast. The Living Healthy podcast is listed on many platforms, including Anchor, Amazon Music, iHeartRadio, Google Podcasts, Spotify, Bullhorn, and many others. You can follow me on Twitter, Instagram, and Pinterest. And don't forget to check out the Living Healthy podcast channel on YouTube. Also, if you have any questions or would like me to discuss a particular topic, or you'd like to be a guest on the show, please contact me at livinghealthy@gmail.com. Have you ever dreamed of starting your own podcast? Well, you can. It's simple, it's easy, and best of all, it's free. By going to anchor.fm, you can start your own podcast today and have your own show up and ready to go. Anchor's graphic user interface is user-friendly, and you get paid for your content by setting up a Stripe account. Go to anchor.fm. Again, that's anchor.fm, and start your podcast today. Asthma. I will discuss asthma by itself, as this symptom tends to be the most common among allergic reactions. Asthma can affect people of all ages, but mostly affects children. When an allergen is inhaled, the overreaction of the immune system causes production of excess mucus and swelling and inflammation of the airway, making it very difficult to breathe. Some people experience wheezing, coughing, and tightness in the chest. Asthma affects people differently. Some people have symptoms every day, while others have symptoms every once in a while. Some people have symptoms first thing in the morning or late in the evening. Others have it when the temperature becomes colder. Some have to always carry an inhaler and learn to avoid allergens that cause the condition. Some of the conditions that cause asthma are laughter, anger, certain foods, mold, ragweed, dust, dirt, cigarette smoke, pollen, and poor air quality. Asthma can also be caused by exercise. The first time I had a patient that had exercise-induced asthma, I found it so interesting that I had to do a lot of research on that case, as I wanted to better understand how exercise can cause asthma. The Asthma and Allergy Foundation of America stated that the term exercise-induced asthma is a bit misleading, as exercise does not cause the condition. They further state that when you exercise, you put great demand on your lungs, and you typically breathe through your mouth, allowing cooler and drier air to enter into the lungs, which can lead to bronchoconstriction. So it makes sense that the climate you're in has something to do with it. Heat rises, and when air is cooler, particles in the air tend not to disperse as much, so it makes sense. The Mayo Clinic states that this condition can happen more often in high-level athletes, although anyone can get it. Examples of type 2 reactions. Examples of antibody-mediated responses, or type 2 reactions, are autoimmune diseases like hemolytic anemia, rheumatic fever, and thrombocytopenia. With hemolytic anemia, a mother's immune system will see the baby's blood as foreign. Now there are A, B, and AB and O blood types. There will also be a negative or positive Rh factor. This is a protein that is found in blood. If you have it, you are Rh positive. If you do not have the protein, you are Rh negative. When a woman gives birth, her blood and the baby's blood can mix. If the mother is Rh negative and the baby is Rh positive due to a Rh positive father, the mother's immune system will see the newborn as foreign. For the first baby, this is not an issue, but the mother's immune system will create antibodies and store them. Future pregnancies can be an issue as the mother's immune system will look at the fetuses as foreign. If the mother is Rh negative and the baby is Rh negative, everything will be fine. If the mother is Rh positive and the baby is Rh negative, everything will also be fine. If the mother is Rh negative, meaning she does not have the protein in her blood, and the baby's Rh positive, that can cause a problem. Miscarriage is the unfortunate result of this blood protein incompatibility. If the child is born, symptoms could include pale skin due to anemia, along with an enlarged liver and spleen. If the condition is known beforehand, there are vaccines available to help mothers to not make antibodies in order to protect the child. Another example of a type 2 ailment is rheumatic fever. This happens when strep throat or scarlet fever are not properly treated. Antibodies are built up against Streptococcus bacteria to prevent future infections. Symptoms are chest pain, heart murmur, joint pain, inflammation, and hay fever. However, the body tricks the immune system into attacking the heart as the myosin fibers have a protein similar to the Streptococcus bacteria. On Gale Academic on File, there's an article by Krishner and Cunningham called Myosin, a link between streptococci and heart. They stated that research has shown in the last 30 years that there are proteins and amino acid residue that are shared by Streptococcus and the heart. This was proven in numerous animal studies researching the association. Thrombocytopenia is another type 2 reaction, more commonly known as immune thrombocytopenia. This happens when the immune system mistakes platelets for antigens and attacks them. This usually sets in after a viral infection or bacterial infection. This is a bleeding disorder that causes a low amount of platelets, and the result is being bruised easily. People typically have excessive nosebleeds, bleeding gums, heavy menstruation, and blood in the stool and urine. Other symptoms are small spots of purple on the skin called petechiae, purple bruises under the skin called purpura, and large purple blotches or spots called ecchymosis. Someone with this condition needs to be cleared by a hematologist before having any kind of surgery and even dental work. This condition can also be caused by genetics, as a person can be predisposed to developing this disorder. It affects children as well as adults. Children usually recover from this condition within a year. Adults usually have this condition throughout life. Unfortunately, doctors are not sure what causes thrombocytopenia. All in all, women are mostly affected by this condition, so estrogen and progesterone may be a factor. Examples of type 3 reactions. Type 3 reactions involve antibodies created for soluble antigens that form complexes with the antigens and deposit in tissue and blood, causing damage. This usually happens when there is an excess in antigens. These complexes are too large to be taken care of by phagocytes, which are a type of white blood cell. They release cytokines, which, due to the locality of the complex, do damage to areas like joints and organs. Examples of type 3 reactions are arthritis, nephritis, vasculitis, Shrogen Syndrome, lupus, serum sickness, and farmer's lung. Arthritis occurs when bone rubs on bone, causing stiffness, pain, discomfort, and sensitivity to temperature. Arthritis can be a debilitating and life-altering disease. Nephritis is inflammation of the kidneys, and this condition prevents the kidneys from operating properly. Symptoms are blood in the urine, high blood pressure, fever, fatigue, and water weight gain. Vasculitis decreases blood flow by causing inflammation in the blood vessels. Blood vessels can become weakened and kill tissue. They can also burst, leading to an aneurysm. Vasculitis can be the result of an allergic reaction to a drug or viral infection or cancer. Shrogen Syndrome is most characterized as dry mouth and dry eye. However, it can affect the whole body. Other symptoms include fatigue, joint stiffness, dry nose, a change in taste and smell, headaches, and vaginal dryness in women. People with this condition are also predisposed to lupus. Lupus, or SLE, systematic lupus erythematosus, causes inflammation all throughout the body. It attacks the heart, brain, lungs, kidneys, liver, etc. One of the most common signs is a rash that covers the bridge of the nose and/or both cheeks. Other complications/symptoms include rashes in other parts of the body, joint pain, shortness of breath, chest pain, cancer, as well as brain, kidney, and liver issues. There are 4 types of lupus SLE that are the most common. Cutaneous lupus, which is limited to the skin, involving rashes on the body and face. Drug-induced lupus, which can be caused by illicit or prescription drugs. Neonatal lupus, which can affect newborns of women who have lupus. And lupus can even be brought on by stress and even childbirth. Lupus mostly happens to women, and predetermining factors include genetics, environmental factors, and hormones. On lupus.org, they state that 9 out of every 10 cases of lupus are in women, and there may be a link between estrogen and lupus. Serum sickness is when you take a medicine or a vaccine and your immune system develops a hypersensitivity to it. The proteins in the medicine or vaccine are falsely identified as antigens. It can be caused by a vaccine or an over-the-counter prescription medication. Some of the symptoms can be fever, fatigue, enlarged spleen, arthritis, and protein in the urine. Farmer's lung, or extrinsic allergic alveolitis, is an allergic reaction that comes from breathing in mold spores and bacteria. On the Canadian Centre for Occupational Health and Safety, they state that the most common organism that causes farmer's lung is bacteria, like Micropolyspora fini and Thermoactinomyces vulgaris, and fungus like Aspergillus. As an example, allergens from hay, animal feed, dander, feathers, droppings, feces, and even moldy crops can cause this condition. Acute farmer's lung causes shortness of breath, a bad cough, tachycardia, malaise, and chills. Continued exposure causes chronic farmer's lung, and its symptoms are chronic cough, chills, fever, fatigue, weight loss, muscle pain, as well as joint pain. Examples of type 4 reactions. Cell-mediated hypersensitivity reactions occur in a period of hours or a few days after exposure. There are 3 types of these hypersensitivity reactions: contact hypersensitivity, granulomatous hypersensitivity, and tuberculin hypersensitivity. Contact hypersensitivity occurs when antigens come in contact with the skin and proteins in the skin, initiating a response. An example would be dermatitis. There are many types, but the overall condition involves either blistering, hives, a rash, red itchy skin, or inflammation of the skin causing physical changes. Eczema is a common condition that has been linked to genetics, environmental factors, endocrine disorders, and damage done to the skin. Symptoms of eczema include itching, red patchy skin, cracked scaly skin, rash, and pus-filled raised bumps or blisters. Granulomatous hypersensitivity takes longer and occurs 3 weeks to a month after exposure. This occurs when inflamed tissue comprised of white blood cells continues to be inflamed over and over in response to microbes. An example of this would be Crohn's disease. Doctors do not know what causes Crohn's disease, but these granulomas consisting of white blood cells and tissue is a key indicator. Crohn's is the inflammation of any part of the gastrointestinal tract. The Crohn's and Colitis Foundation states that Crohn's affects the GI tract, but commonly the small bowel. They go on to state that this condition can skip parts of the GI tract, leaving perfectly healthy areas in between affected areas. Symptoms of Crohn's disease are fever, weight loss, malaise, bloody stool, severe abdominal cramping, arthritis, anemia, nausea, vomiting, and loss of appetite. Tuberculin hypersensitivity is the third type of reaction that can occur 2 to 3 days after exposure. This happens when people who were exposed to tuberculosis or who have tuberculosis are injected under the skin. Many healthcare workers are familiar with this as a requirement for employment. It is a test called the Mantoux tuberculin skin test. This is where you are injected with a protein called Mycobacterium tuberculosis. If you have no reaction or a very small one, then you are negative. If you have a large blister, you have the tuberculosis bacteria in your body. However, that does not necessarily mean that you have tuberculosis. Further testing would have to be done to determine if you are in fact infected. The size of the reaction is what is considered to be a starting point to determine if you have TB. Symptoms of TB are fever, coughing up blood, fatigue, sweats, and chest pain. Another type of disease that has a similar reaction is with poison ivy, or Toxicodendron radicans. This plant contains urushiol, which causes the reaction when it comes into contact with the skin. Urushiol is the sap of poison ivy plants. Poison ivy symptoms include blotchy, itchy skin, rash, swelling, and blisters. Heredity and allergies. Allergies have a propensity to run in families, and they can also be genetic anomalies. They're not always inherited and can be acquired regardless of a genetic makeup of parents, grandparents, etc. What is important is that blood tests must be done to help to determine the allergen or allergens. Then, with a family history, steps can be taken to present a care plan. On the Naturopathic Doctor News and Review website, Feta Surenjan states that acquired allergies can be due to toxins and medications built up in the lymphatic system, as well as the liver becoming weakened due to heavy detoxification. This is true, as allergies are related to poor liver function. The liver stores antibodies called immunoglobulins. These are just proteins in the serum that function as antibodies. GWAS are genome-wide association studies. These studies can help to determine loci linked to a particular disease. Loci, plural for locus, is a gene marker or position on a chromosome where that gene is located. These studies are used to help determine the link of disease and genes. Hingisto, Liley, and Hanif posted a study on biomedicalcentral.com. It is called Genomics of Asthma, Allergy, and Chronic Rhinosinusitis, Novel Concepts and Relevance in Airway Mucosa. They reviewed allergic ailments involving the airway in relation to loci and genes. They stated that in over 30 studies that 170 protein coding genes and 15 pathways are associated with asthma. The same way that traits like eye color, hair color, and diseases like cystic fibrosis and sickle cell disease can be inherited, allergies such as asthma can also be inherited. That's going to do it for part 1 of this 2-part series of the Living Healthy podcast. I want to thank you for listening. I want to thank you for your support, and I'll see you next time. And remember, living healthy creates a better you.